over the last few years, since I was here right after the earthquake, I developed an enormous fondness for the Haitian people. I realized during those early days after the quake that there were a lot of struggles for the Haitian people that began long before the earthquake. The earthquake complicated matters enormously. And as solutions to the problems of the quake, and certainly the suffering that individuals and families went through because of the quake, they may never get over. But as we move forward in rebuilding from the quake, we also need to move forward with all of those problems that were there before the quake, particularly with all the chronic wounds, and very specifically, all the wounds related to diabetes. The amputation rates, the infections, the suffering, the loss of limbs among the diabetic population is staggering here, and not unlike many countries around the world. But we feel that in Haiti, this is where we're supposed to be right now, and we want to develop something in Haiti, hopefully that the rest of the world can use to solve the same problems regarding diabetes and amputation prevention. Collaboration between Hospital Bernard Mevs and the Haitian FADIMAC, being the Haitian Society for Diabetes and Cardiovascular Disease. One of the main cardiovascular diseases that's a major problem is hypertension or high blood pressure, along with diabetes. FADIMAC, being the leader in terms of managing, providing care, providing education for diabetics from the medical end, is a perfect partner for the hospital, because with that partnership, we can train FADIMAC doctors how to identify, how to understand the diabetic foot problem and all the complications much earlier, so that when a patient does get an early diabetic wound, a FADIMAC family practitioner, diabetic specialist, can send that patient to our hospital wound center at Bernard Mevs for early and aggressive and efficient care to heal that wound, whereas traditionally many times those wounds became so infected that the foot couldn't be saved and those patients went on to amputation. The training center will have two sides. It'll have the training for the diabetic patient by the FADIMAC doctors and nurses and staff in regards to understanding why it's so important to control their blood sugars, to control their diet, to control their weight, to stop smoking, all those medical educational pieces that will hopefully create a better, healthy lifestyle sense among the Haitian people, particularly those who have diabetes or those who are prone to diabetes. On the other hand, the educational piece also relates to understanding early recognition of the complications of diabetes. More people are hospitalized for diabetic complications, for diabetic foot complications, than any other complication of diabetes. So we need to create awareness, education, not only among the patients to say, hey, I've got a sore in my foot, I've got to get to the wound clinic, which is FADIMAC's partner at Hospital Bernard Mevs. So early intervention, early awareness, early care. The medical people on the FADIMAC side, the surgical people on the wound side at Bernard Mevs, they have to work together. And around the world, there are just literally hundreds of millions of people, just with diabetes alone, with feet and legs at risk of being lost to amputation. So one of the rules that I've lived by from day one, almost 20 years ago, was that my programs have to be based on the concept of teaching the teachers, of creating trained and educated offspring of myself. Someday I'm not going to be here. But my idea is that if I simply commit to training 100 diabetic wound caregivers and wound prevention caregivers in diabetes in my lifetime, and each one of those 100 trains another 100 in the same skills and the same knowledge, by the second generation of teaching, that's 10,000 trained caregivers starting with me. That's the only way we're going to be successful, and in that way, we could create a firestorm of healing all around the world. I think that we've started a little fire here. We've basically have a little campfire going here that I think ultimately could become a firestorm of education and care as a model for all over the world. The reason I believe that is because I feel what we've done is unique. We've gotten together the diabetes medical educators and medical leadership in FADIMAC with the wound expertise in terms of diabetic wound healing in Haiti to form a marriage, to form a partnership. And I know in working all over the Caribbean for the last 20 years that there's so many needs for this type of, the impact of a partnership like that is needed, in other words, in all of those countries. So our goal ultimately is to create a center of excellence here, develop a teaching center here, not only for teaching and healing Haitian diabetics, but and training Haitian caregivers, doctors, nurses, physical therapists, but creating a center where we can invite caregivers who try to prevent diabetic wounds and treat them all over the Caribbean, and maybe even develop an annual conference, what I call a Pan-Caribbean conference on diabetes and wound healing. And the bigger vision is Caribbean is one region of the world. There's doctors all over the world that have the same need for knowledge. So ultimately the vision would be to develop an international conference on diabetes and wound healing where we can invite diabetic wound caregivers from every country in the world to come here to Haiti and make this that international center of excellence as we all envision it. I realize that everybody in the world, and even the very, very poor, are very much connected to us, and that we're all sort of in one big family. And if we don't acknowledge that sense of family and a sense of commitment to that larger family of the world, then I think we're missing the point of being human beings. Everybody in the world, regardless of their circumstance, regardless of their wealth or lack of it, their poverty, their malnutrition, their lack of medical care, that they all felt the same pain I do. They felt suffering as I did. They felt anguish with loss of a family member or a loved one as I do. And they bled the same way that I did, reinforcing with me that we're all very much the same at the end of the day. And that I began to realize that I as a human being would be diminished as a human being if during my lifetime, and I realize now a lifetime is very short, you have very little time to really do something important for others, that if I didn't do everything I possibly can to help those people in terms of even a little bit, reducing their pain and reducing their suffering and giving them mostly a little bit more hope for themselves and for their family for the future.